healthcare bill proposals on Capitol Hill all require that every American have health insurance. And without it, you could face tough fines. In the proposal by Senator Max Baucus, those penalties could be as high as $3,800 a year. And families on modest incomes might need to devote a fifth of their income to health insurance to avoid a fine.
His plan has suggested that Americans could be required to spend 20%, nearly 20% of their income on health insurance. That's simply unaffordable for a family who's around 400% of the poverty line, struggling to pay their bills, let alone pay for health insurance.
The issue of affordability was one then Senator Obama brought up on the campaign trail and in these flyers, criticizing Senator Hillary Clinton's call for mandated health insurance. Mr. Obama, pointing to the experience of Massachusetts, called the fines a stiff penalty.
Now they're worse off than they were. They don't have health insurance and they're paying a fine.
Now President Obama has embraced the idea of mandatory insurance and the threat of fines. Why? To bring down the cost of universal health care requires having not just older and sicker people in the insurance pool, but spreading the risk. This according to Families USA, which supports care overhaul.
The costs for people depend on who's in the insurance pool. If the insurance pool is only made up of older, sicker people, then the premiums are going to skyrocket.
The congressional bills offer subsidies to low-income people to help them pay for health insurance. But getting coverage is still going to take a huge chunk out of the average family's paycheck. Based on an analysis of Congressional Budget Office projections, a family of four making $42,000 a year and receiving subsidies will still have to shell out about $6,000 a year of their income. A family earning $54,000 a year could see 18% of their income going towards mandatory health insurance.
I think the idea of the individual mandate is really going to rub a lot of people the wrong way. It's really going to feed into this idea that the government is really kind of taking over health care, essentially.
Healthcare prompter. And Senator Baucus, in a news conference, he acknowledged that his bill is not exactly perfect, but the reason why he did this is that he wanted to limit the overall price tag of his legislation.